Millions more rapid tests are heading to Massachusetts and will be arriving on a rolling basis. The announcement comes on the same day that lines wrapped around a testing site in Worcester. Today, Governor Charlie Baker also outlined new guidance on who should take a COVID test. 12 News reporter Anita Buffoni joins us now live in the newsroom with those details. Anita?
Well, Shannon, you can see in this video that the demand is high for testing, and these 26 million rapid tests will help with that. But Governor Baker said those tests will first be prioritized for K-12 education and child care programs. Governor Charlie Baker making the case for rapid tests over the regular use of PCR tests, as the state expects a massive shipment of rapid at-home tests this week and through March.
The PCR test is appropriate in certain circumstances, but these rapid tests can be used in many circumstances as a legitimate alternative.
Part of Tuesday's announcement includes clarification by the Department of Public Health about who should get a COVID-19 test in the Bay State. People who have symptoms and those in close contact with someone who is positive for the virus.
We do not believe, DPH does not believe, by the way, the CDC and the federal government don't believe either, that you need a PCR test to go back to work, to back to school, or back to child care.
As Baker recommends moving away from the regular use of PCR tests, a group of Massachusetts doctors are calling on the governor to increase the availability of both rapid and PCR tests. The demand is skyrocketing. This is a line outside a COVID testing site in Worcester, where many braved the cold to get swabbed. Sites like this one at the Fall River Fire Department are opening up across the state to help with that demand. Officials say at this site they administered 300 rapid tests as of Tuesday afternoon. And Governor Baker said he's activating an additional 500 National Guard members to help out with the staffing crisis at hospitals as they grapple with that staffing crisis. In the newsroom, Anita Buffoni, 12 News.
In Massachusetts, Governor Charlie Baker told lawmakers again this afternoon that he is committed to keeping schools open, though he admitted that it's been difficult to convince parents to get their kids vaccinated. He's also saying that schools and workplaces should rely more on rapid tests. And with long lines continuing at testing sites across the state like this one, the governor announced millions more rapid tests are on the way. 12 News reporter Anita Buffoni tells us who will receive them first. Anita?
Well, Shannon, Governor Charlie Baker secured a contract with iHealth, who is supplying the 26 million rapid tests that will be prioritized for K-12 education and child care programs.
Today we're announcing
millions of rapid tests are on their way to Massachusetts, arriving on a rolling basis. 26 million COVID-19 rapid tests will be prioritized for K-12 schools and child care facilities. They will be distributed over the next 3 months. The tests are on top of the 2.3 million distributed to schools and hard-hit communities before the holidays. Governor Baker making the case for rapid tests over the need for PCR tests in order to return to work or school. PCR tests get sent to a lab. Turnaround times are about 3 days.
We believe the antigen tests, which are enormously accurate, especially on the back end of contagion, are a perfectly suitable solution.
As Baker recommends moving away from the regular use of PCR tests, a group of Massachusetts doctors are calling on the governor to increase the availability of both rapid and PCR tests. The Omicron variant contributing to the increase in demand for testing. New sites like this one at the Fall River Fire Department are opening. The Department of Public Health also clarified who should get a COVID-19 test in the Bay State. People who have symptoms and those in close contact with someone who is positive for the virus. And as the healthcare system still grapples with a staffing crisis, Governor Charlie Baker said he is activating another 500 National Guard members to help at hospitals and emergency rooms. Anita Buffoni, 12 News.